It was really scary. I didn't even think that I had cancer, because when they first told me, I said, "Where does it say so on this sheet that I have cancer?" And it was stage 3C. It was estrogen positive, progesterone positive, and a HER2 positive, and it was pretty bad.
And Amy's story is remarkable. Not only that she's still living cancer-free with how she presented, but also given her diabetes and all the things she went through, the kidney issues, and the fact that Amy and Vaughn worked diligently going from medical center to finally get her a new kidney. And so thankfully her kidneys are working great now.
I really think the thought was that I wouldn't still be here, but I am, and I'm going strong.
As the chairman of the board of directors of the cancer division of the Oconee Memorial Hospital Foundation, this is our number one priority, and it's the number one priority for fundraising for the foundation this year, is to try to get a much better physical plan for our patients that are going through the cancer journey in this general area. This Cancer Institute has been doing a great job for the past quarter century, but it has, with the growth of the area and the growth of our catchment area, is just exploding with patients, and they really need a more attractive and spacious place to come.
I just think that it needs to be expanded so that they can bring in more nurses and more infusion nurses and more doctors, and because unfortunately there's a lot more cancer cases. So this is our way of, we were going through our will, and we just wanted to become part of this.
In the years that I was in Seneca, I enjoyed the patient care and the patients more than I did my entire career. It extended my career, made me happier through my career than any place I worked.
Now I'm a volunteer at the Cancer Center, and I love it because it gives me the chance to share my story with the people that have cancer there, and you can always see it in their eyes when they look like the deer in the headlights. And I said, "Is this your first time?" And I've had so many instances where that has happened, and you can just relate. You just can try to make them feel better. And
it's just important to me, and it's important to my wife as well, because she saw how I became more happy in my job and what I felt like I was able to do for people while I was here. And I think that the doctors that are presently manning the Cancer Institute are feeling that too, but they're limited by the building right now. And so I just think that if there's anything that I can do personally or as a leader, I want to be part of that effort because it's just the right thing to do. This community never ceases to amaze me how generous they are when it comes to their health care, and how much they want to partner with our health system to do the right thing, to keep our people here, not having to go for some other therapy someplace else.
I think supporting this hope, the Building Hope campaign, is so important because, like I said before, the demographics are indicating that it's so necessary. It's too small the way it is.
In 2001, when the Cancer Institute was first developed, our radiation therapy where people were going to Anderson or Greenville every day for 30, 40 days in a row. And so I just want us to continue to grow and have more capabilities and more things that we can do that will keep our residents here when they have the need to be here for their cancer care.
I just hope everybody decides to donate towards this because it is so important. It's just so important. The Cancer Center now is 10 years past when I had it, and there's such a need for the expansion. And I just can't wait to see it happen. So